My theme is primary glomerular diseases in University Clinical Center of Republic of Srpska, Banja Luka, results of kidney biopsies in period from 2007 to 2023. Kidney biopsy is a gold standard for diagnosis glomerular diseases, prognosis glomerular disease, and it is a roadmap for treatment glomerular diseases. On the Department of Nephrology, internal medicine clinic, our clinical center, in this period, we performed 349 kidney biopsies. Pathological analysis of kidney tissue was done at the Clinic for Pathology, our clinical center. It was 196 men and 153 women, and 199 patients aged from 18 to 65 years, and 15 patients aged over 65 years. It was a representative sample in 310 patients. Unrepresentative sampling in all period, about 11%. In beginning, from period 2007 to 2015, it was 13.8 unrepresentative samples, and in last period, from 2015 to 2023, about 6%, we performed a more successful kidney biopsy in last period. Biopsies were performed with biopsy gun, fast gun, and used the needles for biopsy diameter 16 gauge. For all patients, we took 2 samples for optical microscopy and immunofluorescence analysis. We didn't have technical requirement for electronic microscopy. For 7 patients, we took samples for electronic microscopy analyzed in a clinical center Dubrava, Zagreb. We have good cooperation with this clinic. Indication for kidney biopsy in University Clinical Center, most frequent is nephrotic syndrome, 58%, nephritic syndrome 17.2%, asymptomatic urinary abnormalities 13.4%, chronic renal failure 7.4%, acute renal failure 3.7%. In beginning, nephrotic syndrome was most frequent than in last period. Then nephritic syndrome, asymptomatic urinary abnormalities. For 310 patients with representative sample, pathological diagnoses were classified into 5 minor groups modeled on the Italian register. It was primary glomerular diseases 50% or 155%. Secondary glomerular diseases 33.8%, vascular diseases 7.4%, tubulointerstitial disease 3.5%, and miscellaneous or other cable or not specific diagnosis about 5%. Most frequent primary glomerular disease by our patients is membranous glomerulonephritis. It was 45 patients with membranous glomerulonephritis, IgA nephropathy 32 patients, focal segmental glomerulosclerosis 28 patients, minimal change disease 17 patients, membranoproliferative glomerulonephritis 13 patients, mesangial-proliferative glomerulonephritis 12 patients, primary crescentic glomerulonephritis 5 patients, and post-peripheral glomerulonephritis 2 patients. The most frequent primary glomerular diseases, percent of all primary glomerular diseases, membranous glomerulonephritis 29%, IgA nephropathy about 20%, focal segmental glomerulosclerosis, minimal change disease. We divided the secondary glomerular diseases in 3 major groups. Immunological modeled on Italian registry 2, immunological mediated lupus nephritis, ANCA vasculitis, good pasture syndrome, most frequent the lupus nephritis and ANCA vasculitis. Second group, dysgammaglobulinemia associated glomerulonephritis, amyloidosis, light chain disease, cryoglobulinemia. And third group, metabolic and hereditary disorders associated, diabetic nephropathy, 16 patients, Alport syndrome, thin basement membrane disease. Last 2 diagnoses made by electron microscopy. Diseases that are most often clinically manifested as nephrotic syndrome were minimal change disease, 94% or 16 of 17 patients in which were performed kidney biopsy, membranous glomerulonephritis 40 of 43 patients, amyloidosis 12 of 13 patients, diabetic nephropathy, membranoproliferative glomerulonephritis 11 of 12 patients. Nephritic syndrome biopsy was done in 60 patients who had nephritic syndrome. 6 patients didn't receive a good enough sample. The most common diagnosis in patients who had nephritic syndrome, acute or chronic, P-ANCA vasculitis, C-ANCA vasculitis, 16 patients, IgA nephropathy, lupus nephritis, focal segmental glomerulosclerosis. Vasculitis, P-ANCA or C-ANCA, were clinically manifested as nephritic syndrome in 16 patients of 24 patients, mainly as rapid progressive glomerulonephritis. Asymptomatic urinary abnormalities. Biopsy was done in 47 patients who had asymptomatic urinary abnormalities. In 5 patients was not a good sample. The most common diagnoses in these patients were IgA nephropathy, lupus nephritis, and focal segmental glomerulosclerosis. It is also generally known that IgA nephropathy usually manifested at the recurrent hematuria and or non-nephrotic. The most common diagnosis of all glomerular diseases were membranous glomerulonephritis, lupus nephritis, IgA nephropathy, focal segmental glomerulosclerosis, ANCA vasculitis, diabetic nephropathy, minimal change disease, amyloidosis, membranoproliferative and mesangial-proliferative glomerulonephritis. Kidney biopsy were performed in 25 patients, about 7%. Reasons for kidney biopsy: the first biopsy didn't receive a good enough sample, 40 patients, or monitoring of the disease, effect of treatment or change pathohistological type on 11 patients. Kidney biopsy complication. Small or minor complication, overall 24 patients, or about 7%. Hematuria, 12 patients. Small renal or bladder hematoma, 12 patients. Major complication, renal large hematoma or the blood transfusion necessary, less than 1%. Patients older than 65 years in University Clinical Center, we performed 50 kidney biopsies, or 14% of all biopsies. Representative sample, 43 patients. Most prevalent pathohistological diagnosis of glomerulonephritis were membranous glomerulonephritis in 14 patients, Pianka vasculitis 13 patients, amyloidosis 5 patients. Comparison with other countries, similar situation is from Spanish biopsy registry, most prevalent ANCA vasculitis and membranous glomerulonephritis, similar us. Serbian 1-year report for all country, most frequent were membranous glomerulonephritis, focal segmental glomerulosclerosis, and membranoproliferative glomerulonephritis. Polish biopsy registry, similar Serbian. Most frequent were membranous glomerulonephritis and focal segmental glomerulosclerosis. Comparison with the other countries and regions in indication for biopsy in percentage. Most frequent indication for biopsy is nephrotic syndrome in majority countries. Then in Italia is most frequent is asymptomatic urinary abnormalities. Second most frequent in majority is asymptomatic urinary abnormalities. By us is second most frequent is nephritic syndrome. Pathohistological comparison in the primary comparison in the diagnosis primary glomerulonephritis, representation by percentage of all kidney biopsy. Membranous glomerular IgA nephropathy is majority countries. Membranous glomerular IgA nephropathy is most frequent primary glomerulonephritis. Second most frequent in Italy is membranous glomerulonephritis. In Croatia and Poland is focal segmental glomerulosclerosis. Very interesting is in German crescente glomerulonephritis, about 10% primary glomerulonephritis. In Serbia, frequent is mesangial proliferative glomerulonephritis. IgA nephropathy is most prevalent primary glomerulonephritis disease in Germany, Italy, Spain, Croatia, Czech Republic. Membranous glomerulonephritis in Macedonia, Bosnia and Herzegovina. Mesangial proliferative in Serbia. In the world, Brazil is most common primary glomerulonephritis, like Saudi Arabia, and lupus nephritis is most common secondary glomerulonephritis. And finally, in the case report, patients 27-year nephrotic syndrome when was 4-year-old, therapy corticosteroids, then 3 mild relapses nephrotic syndrome to 17-year. First examination by an adult nephrologist 8 years ago with nephrotic syndrome proteinuria 21 grams per day. We performed a kidney biopsy and pathological diagnosis was minimal change disease. Therapy 3 pulses methylprednisolone, 3 ml 500 milligrams, then prednisolone, therapeutic effect remission. disease relapse after 3 months, then cyclosporin and prednisolone 18 months, remission and relapse after 6 months. Next year, several episodes, massive nephrotic syndrome, we tried with tacrolimus 6 months and prednisolone, always short-term remission behind that relapses. In April 2022, massive nephrotic proteinuria, 32 gram per day, albumin in serum 8 gram per liter, anasarca, bilateral pleural effusion, therapeutic albumin intravenous, methylprednisolone 3 ml 500 milligrams. We performed a kidney rebiopsy 22 April 2002 with 3 samples, optical microscopy, immunofluorescence, and electronic microscopy, pathological examination in a clinical center Dubrava, pathological diagnosis, minimal change disease, combined thin basement membrane disease. We decided for therapy rituximab 500 milligram once a week, 4 doses, and methylprednisolone. After the 3rd dose is rituximab, partial remission. After 4th dose, complete remission. Then maintenance therapy, rituximab 500 milligrams intravenous every 3 months, oral 4 doses, methylprednisolone 20 milligrams per day. Finished in July 2023. Complete remission already, 70 months. And finally, the main clinical indication for kidney biopsy in our clinic, almost 58% patients was nephrotic syndrome. The most common primary glomerular nephritis was the membranous glomerulonephritis, IgA nephropathy, focal segmental glomerulosclerosis, minimal change disease. The most common secondary glomerulonephritis were lupus nephritis and ANCA vasculitis. The most common in the elderly population, membranous glomerulonephritis and ANCA vasculitis. We had a very small number of serious complications and a small unrepresentative sample than before. Thank you for attention.